Hi, my name is Jean. I'm going to be your student nurse today. Would it be okay if I do a head-to-toe assessment on you?
Yes.
Okay. Can you state your age for me?
21.
And what's your name?
Michaela Gorman.
Okay. Can I just check your wristband? Okay, we're all good. So you said you're 21. I can see you're Caucasian. You are a female. And what is your general state of health?
I would say healthy.
Okay. And what is your height?
5'7".
And your weight?
140.
Okay, let me check. So your BMI is 22, which is good. Do you have a reason why you're here today?
Just for a general assessment.
Okay, you are dressed very nice and clean. Your hygiene is good. Your grooming looks good to me. You're very cooperative. I can tell by talking to me. You're animated. I can tell even under the mask you're smiling. Your thought process is logical, relevant. You haven't gone off track yet. Neither have I. Your speech is pretty clear. Can you tell me your full name?
Michaela Mary Gorman.
And where are we at?
My house.
And what time it is?
It's about 6.
And what's going on?
You're just doing a head-to-toe assessment.
Okay, sounds good. So you're alert and oriented times 4. So I'm going to test your memory now. So can you tell me who the president was before President Trump?
Obama.
Okay, and then what's my name?
Jean.
Okay, and then if I were to say an apple a day keeps the doctor away, what would you interpret that as?
Just that's what keeps you healthy.
Okay, and then say it were snowing outside, what would you do to prepare to go out?
Bring snow boots and a heavy jacket.
Okay, sounds good. You have great judgment, 'cause I hope you'd bring a coat for that. So now we're going to do your temperature. I'm going to use an oral thermometer with a little cover slip on it. Maybe. There we go. Okay, I'm just going to place this underneath your tongue till it beeps. Okay. It's reading 96.3, which is great. Do not have a fever. So now can I have you place your arm up onto the table? I'm going to take your pulse and count your respirations. Okay, so your respirations were 14, your pulse was 84, which is all within the normal limits. I'm going to take your blood pressure now. So do you know what yours normally ranges around?
Normally, it's pretty normal.
Okay.
Sometimes on the lower side, if anything.
Okay. I'm just going to have to ask you, pull it down a little bit and then roll up your green shirt. All right. We're doing this on your right arm. So can I just have you straighten out your arm and lay it flat like this? There we go. I'm going to tighten it just a little bit. Get 2 fingers underneath. Good. Let's put this up here. Actually, I'm going to keep this down here out of the way just so I can read it. Now have you lift up your arm so we can have this out here. Righty tighty. Yes, there we go. Okay, could I have you straighten your arm so I can try to feel your pulse? I will find it, but nope, it's right here. Okay, keep it right there. Okay, I'm gonna ask you to relax your arm. All right. All right, I got 110/78, which is great. Let's get this off of you. All right, and then are you experiencing any pain today?
Nope.
All right, sounds good.
Video.
All right, so now we're going to move on to lungs and thorax. I'm going to start on the anterior portion of it. So I'm going to inspect and palpate the front of you. Is that okay?
Mm-hmm.
All right, I'm going to pull this down. The color is appropriate. Temperature is warm. We're going to just pinch about an inch of it. It's really good. So you have good moisture. The texture is smooth and you're negative for lesions. So I'm just going to look at you. Your thorax is the appropriate size for your body. The shape is good. It's symmetric. Can you just like shrug? Just show me some movements. Okay, look all good for me. I'm going to palpate your clavicle and sternum. Okay, we're going to start at the sternal notch. Go down. All right. It's good. Okay, so I'm going to feel your shoulders. Okay, same height. Can you shrug for me? Okay, good strength. Now the excursion, I'm going to place my hands at the base of your lungs. I'm going to have you breathe in really deep. Is that okay?
Mm-hmm.
Okay. All right, excursion is good. It's deep and symmetrical. So I'm going to ask you just turn to the side. I'm going to lift up your shirt and just inspect your lateral side. Okay, color is good and you're negative for any lesions. Now I'm going to check the posterior of you.
Mm-hmm.
So you want to spin around. Perks of having a bar stool.
Mm-hmm.
All right, so I'm just going to check the color up at the top. All right, color is appropriate, negative for lesions. I'm going to feel your scapula. If you could just like give yourself a little bit of a hug just so I can feel them. Oh, you probably can't see. Okay, there we go. So now you can let go. I'm going to check the placement of your spine. So we're going to start up here, cervical, move down into thoracic, lumbar, and finally sacral. It is all straight. All right, so I'm going to measure the size of your thorax. If you could just spin just a little bit. I'm going to put my hand in the Pledge of Allegiance spot and do that. I'm going to go right here and here. I'm going to take it, go right here. Okay, we can see it is half of the transverse diameter, which is good. And you have no barrel chest. All right, now I'm going to have you, I'm going to turn the camera a little bit. If you could just turn to the side a little bit more. Right there, I'm going to come around to this side. So I'm going to check the S curvature of the spine. It is concave, convex, down to concave again, and convex. So you do have the appropriate shape of the spine. All right, so I'm going to do some listening to your lungs, going to auscultate. All right, so I'm going to have you take some deep breaths, but no, like quicker than normal, okay? So we have 6 spots on the front, so that's where we're going to start. Go ahead and breathe in. Can you see where I'm going on the screen?
Mm-hmm.
Okay. All right, your lung sounds anteriorly are clear. I heard vesicular breath sounds. So I'm going to have you turn around and we're going to do the posterior part of your lungs. Now, can I have you give yourself a hug? All right, so now we have 7 spots on the back. You're going to go ahead and do that now. you just want to move your hand for 1 second on this side, I'm going to go up here. Big deep breath in. One more. Okay. Posterior lung sounds are clear and regular. Okay, so now we're going to do the cardiac assessment on you. So I have you laying down on our makeshift bed. I'm going to look for heaves and lifts, pulsations, negative. So now I'm going to feel for any pulsations and throws. We're going to start right here, second intercostal with the aortic. Negative. Pulmonic. Negative for throws. Herb's point, negative for pulsations. Negative for throws. Fourth intercostal. Negative. We're going to go down to tricuspid. Sorry, just hit you in the face. Negative. Then mitral. We have a faint tap. It is regular with the vitals. All right, so we're all good there. So, and then right here with the mitral is the point of maximal intensity. Right there at the mitral spot. So now I'm going to go ahead and listen 3 times. So first time through, I'm going to do it with my diaphragm. Just sound for the appropriate relation between S1 and S2. Go aortic. Pulmonic. Herb's point. Fourth intercostal. Tricuspid. Baby steps over to mitral. The mitral, fifth intercostal. All right, so now we're going to go through the second time, and we're going to listen for high pitch extra sounds starting down here at the mitral. Inch across to tricuspid. The fourth intercostal. Herb's point. Pulmonic. Aortic. Going to flip it and listen for low pitch sounds with the bow. Aortic. Pulmonic. Herb's point. Fourth intercostal. Tricuspid. And mitral. All right, we had no extra heart sounds. So now I'm just going to percuss the precordium across the second intercostal space. So we're going to feel here. Resonance. Resonance. Dull. Dull. Resonance. All right, so size is how it should be. And that is it for our midterm return demonstration.